Whether your dog got into a fight with another dog, or your cat came home after an encounter with a stray animal, or your pet was attacked unexpectedly, knowing what to do after the incident can make a huge difference. So, today, let's talk about exactly that. Welcome to the Practical Pet Parenting Podcast, where science and research meets simplicity, practicality, and humor. Because we all know that pet parenting isn't just one thing. It's magical, beautiful, life-changing, frustrating, and overwhelming all at the same time. I'm Dr. Ashita Suresh, a vet, a mom, a dog mom, on the multiple species pet parenting journey just like so many of you. Join me as we cut through the noise, fear, and fluff and take pet parenting from overwhelming to, well, barely manageable. First things first, check your pet carefully. Once the situation is safe and your pet is calm enough to handle, try to examine them as thoroughly as possible. This is mainly to mark where any injuries might have occurred, even the tiniest ones. Bite wounds can be deceptive, meaning what looks like a very tiny puncture on the skin may actually hide significant damage underneath it. Plus, teeth can push bacteria deep into the tissues, creating pockets of infection that aren't really obvious right away. So, check your pet's entire body, including the fur around the neck, chest, abdomen, legs, and tail. Look for puncture wounds, bleeding, swelling, pain, or any limping, or any areas where your pet tends to react when touched. But do remember that if your pet is very scared or very painful, don't force the examination because your safety matters and they may not take kindly to it at this point. Next, try to remember details about the attacking animal. Now, if you saw the incident happen, try to remember as much as possible about the animal involved. Was it a single animal or was it a group? Did it seem healthy and coordinated or was it behaving very strangely? Did it appear aggressive without reason? Maybe it was disoriented or maybe a little off. All these details can help your vet make some good guesses as to what the risk was of the animal being rabid or having any other infections as well. Third, get veterinary care immediately. Now, even if the wounds look minor, your pet should be seen by a veterinarian as soon as possible. Like I said before, animal bites that look really tiny can cause a lot of damage, so they should always be assessed. Things that your veterinarian may recommend include cleaning and flushing of the wound, pain relief, antibiotics, any combo of these, and even further investigations depending on the condition of your pet. Now, this may sound surprising, but most times bite wounds are not stitched up because of the risk of trapping any infections inside. However, the final decision, because there can be some exceptions, is always left to the examining vet. Lastly, don't forget vaccinations. Depending on your pet's vaccination history and the species involved of both the victim and the attacker, a booster vaccination or additional precautions may be recommended. This is especially important if the attacking animal's vaccination status is unknown. Now, before we go, a quick word about snake bites. If you suspect or you've seen that your pet has been bitten by a snake, don't waste time. Just remember two things. Try to take a picture of the snake, or at least remember as much of the snake as possible, any markings, whatever it is, to identify it or describe it later. And second, get to a vet immediately. That's it. Animal bites are one of those situations where acting quickly can prevent much bigger problems later. While it's best to not be in that situation at all, it can make a world of difference to be prepared. Thank you so much for listening to the Practical Pet Parenting Podcast. If you found this helpful, don't forget to follow, rate, or review. Whatever your podcasting app allows you to do it. You can also find me on Instagram at Indian Pet Vet and read more at practicalpetparenting.com. Much love to you and your pets, and see you next week.